Karen has that same passion and has this vision for how good quality care can happen in rural communities, and has helped, I think, both Rob and I think about how we can take Chapel Hill expertise and move it out to rural communities.
I think Karen has a unique ability to keep her eyes on the prize and to organize a large group of people and organize all the thoughts around this complicated subject. I think that channels down to me at the professional level and helping me keep my eyes on the prize.
I think for me, the examples of Karen's impact have to do with families in rural communities and really with primary care physicians in those communities, so that we now have primary care physicians in eastern North Carolina who will call either Rob or call one of my team members and say, I attended your program, I know that this child has symptoms of autism based on what I've learned. Now I want to get him a referral, what should we do next? And so we've really encouraged primary care physicians to learn how to manage people with autism in their own clinics and then know when they need help and given them a direct path to somebody who can help them. And I think that's Karen's vision, is that families don't have to come to Chapel Hill for services. Families can get services in their home community, but their caregiver, their pediatrician or their mental health clinician knows who to call and contact for advice and support. So she's built a support network for rural primary care and mental health clinicians all over the state. I think that's a huge lasting impact, whether she's actually interacted with or touched one of those families or one of those primary care physicians, probably not. But it's her vision and mission that is leading us to be able to do that work.
She can collaborate with so many different people from different walks of life. She can partner with the dental community and connect the dots with the medical home. She can partner with mental health and connect the dots with the IDD population and how that works with the educational system. It's been amazing to see how she can pull all the partners together and make sure each partner's getting their need met while making a system change for our families that are raising kids with IDD.
Karen Lucan is someone who understands the lay of the land, makes sure that individual voices are heard, and then connects the dots for people. As a professional in the field, as a person with a disability, I truly appreciate what Karen does. She has this deep knowledge base, she brings people to the table, and instead of just handing out name cards and invitations to a table and to a meeting, she makes sure that she has people who are prepared to be at that meeting. And she does that by calling people in advance, offering to meet with them, working out terms of art, letting people ask questions so that when they're at the table, when they're in that room, they feel prepared, they feel empowered. And that recognition that it's not just about telling their story, but telling their story in a way that will resonate with stakeholders who have diverse knowledge and views.
Leadership was the big key, that she has been able to make changes in our system for the long term, for our families. So I think that leadership that she has exhibited and took on and built that system of making sure that we've got what we need to know in order to move into Medicaid transformation. And I mean, I think a lot of the support that she's provided our state in making sure that this is going to be an easy transition for communities and for families and for self-advocates as well.
So I hope my legacy is that we can always learn from others. We should always contribute in the here and now. And those efforts inform how the system gets better over time.